from all of the information I've been gathering. So I didn't make any slides about myself, so hello. I'm Meagan Alley. I've been here on staff for 1 year. I graduated from Rice in 2008, and after that I got to work for a sociology professor for 2 years. I became her project manager. I learned a whole lot. Her name is Elaine Howard-Eklund, and she did a similar study among academic scientists. So that's where the inspiration for this study actually came from. And Dr. Graham said, you know, I like your study and all, but I want to know what doctors think. And I said, well, I could do that for you. So that's what I've been up to. I think all of us here, we have this interest already in the connection between religion and science. And so it kind of makes sense to ask, well, what about these healthcare providers? What do they actually think about religion? What do they think about all these practices? Their own personal belief, and also, how does it work with medicine? And also, Houston is just a really perfect spot for this, with the Texas Medical Center and so many different physicians in the area. All right, so like I said, we have two different goals that I was going for. First, finding out what doctors actually believe about God, about religion, and also how they think it plays a role in their practice. Do they keep them completely separate, or do they let them overlap? There are 3 different studies that I get to compare my data to, because first, there was a national study done along these lines. Some other people are interested in this too, go figure. Farr Curlin up in Chicago has done a national study of doctors to see this very thing. He was focused more on how the doctors see them interacting with each other. And so I also pulled from the Religion Among Academic Scientists study, which Elaine Eklund did and I got to work on. And then the third population that I get to compare to is the general population. So finding out what these highly educated populations think and believe is one thing, but let's take it back, and especially doctors dealing with patients all the time. What's the disparity here? If there's a big disparity, then somebody's going to have to learn how to talk about these things. So the actual survey I came up with was 8 pages long, 33 questions, mostly multiple choice to make it easier for me to compare all the data. I mailed it to them. We tried calling them. I've emailed all the medical students, all had email addresses, which was a great help, so I didn't actually have to mail them anything. So I just emailed them a bunch of times. But most doctors, I was disappointed to find out, they don't actually list their email addresses, which made sense in thinking about it. They don't want patients bothering them all the time. But I wanted to bother them so that I could give them a $5 gift card to Starbucks. Which in the social sciences, any kind of incentive like this is a great help for your response rate. So even though these guys, you know, they're super busy doctors, they can afford a little latte for themselves, but still, just promising them something was a great way to boost our response rate. So the people that we actually talked to, I couldn't just pull out the phone book and look up doctors. I had to have a list to make it as scientific as possible. So I took a random sample of everyone listed in the Harris County Medical Society. So I had the 2010, this was last year, back in October and November, I was making this sample. So I pulled about 10% of everybody's for a total of just over 1,000 people that were mailed either electronically or a physical copy of the thing, of those survey. So overall, I had either a 27% rate or a 30% rate, depending on how you spin the numbers. Of course, that's going to be the basic. And I have a great justification for why I think 30 is the truer number, more representative, an actual number. But in the interest of time, if you're interested, I can go into all the details of setting up and calculating the sample, because now I know it really well. But right, these are sort of my excuses or reasons why it's not higher. I was really optimistic and had to scale it down and realize that 30% with a busy population like doctors are, and for as mobile, like the residents, hardly any of the residents were there anymore. We got so many returned, like bad address, the phone numbers wouldn't work anymore, because residents are here for, a few years and then they leave. So I didn't feel so bad about that. Right. So among our results, first, sociology background. I start off with the statistics like demographics. I get really excited about those, just to see what we're dealing with. So among our entire sample of 283 people who responded, about 30% of them were female. So I wrote that down also according to rank. We asked students, residents, active physicians, and retired physicians, all these things. So I have the 4 different categories. I sort of put the students and residents together because there were so few residents. So a full half of the students and residents were female, and then that number dropped off as the category got older. So among the retired, 9% of the retired physicians who answered were female. So that kind of trend follows along with the race of different minorities, and also among citizenship status. So in general, the whole point from here is that the younger generations are more, there's a lot more diversity in those ranks, which is interesting to me, just in and of itself, but it's also interesting because it maps to a larger trend of what's happening in Houston for the last 30 years or so. There's a sociologist also at Rice, Stephen Kleinberg, who's been studying and doing a survey of Houston every year for 30 years. And that also, I mean, it's reflected in the US Census also, of that Houston itself is now, it used to be completely majority white and Christian. And so now it's become so, there have been so many minorities to come in that now it's what we call the majority minority. So whites are actually less than 50% of the population now. And so it's exciting to me that the populations of residents and students reflect this change. And the fact that citizenship status, a lot of these people, a good proportion of them, were either born in another country themselves or their parents were born in another country. And that speaks to the international nature of not just Houston, because we're a big target city for incoming immigrants, but also to the Texas Medical Center, which has affiliations with schools and research institutions across the world. People come here for training and things. So that was exciting for me to see that in our data. This is more happy tables that I enjoy. Mostly giving the numbers on the immigrants, ending up with the total. But yes. So getting into the first question, the main question that I had was, what do these people actually believe about spirituality? And then next we'll find out how they think it works with medicine. So about 20% of Houston physicians fall into what we would call no religion, or the people who would say they're agnostic or atheist. Or atheist is I do not believe in God, and agnostic, the academic sense for this is that I don't know if there's a God and there's no way to find out. That's the classic agnostic stance. And so I love the part of being able to compare these to the previous studies that have been done. So not only to the elite scientists in the top 20 schools that Elaine studied, she found much higher rates of atheism and agnosticism than what we found. And so that, I was curious about that. That was an initial hypothesis. Is our population, because the doctors also have high education levels, just like the people in academia, but they deal with people all day instead of ideas. And how is that going to change what rates we come up with? And so that's one of the overlying themes. I'll be able to point this out many times, that our doctors are more closely aligned with the general population as far as religious beliefs go than their academic counterparts. So, right.
Well, before you move,
oh, yeah?
If I understand it, the Houston physicians, 53% of them said they have no doubts about God's existence.
Yes.
And compared with the hard scientists, the elites, you call them elite, I call them
That's what she
hard.
calls them also.
They are 9%. That's a very interesting difference.
I'm glad you brought that up, because that was striking to me. I was not expecting such a, that's all over half of our physicians saying, yes, I have no doubts about this. God absolutely exists. Which, that same sort of thing is in a couple different slides. One thing that I'll also suggest for future research is to find out if there's a response bias, because we had 30% who answered, if the people who are already very committed religiously and who know that there is a God and all this stuff, if they were more likely to first be interested in it and go, a study about religion, they should totally do that. What? It's about time. And much more likely to participate, to fill it out completely, and then go through the trouble of sticking it in the envelope, which I made for them, and sending it back in. But so there is a possibility that the people who were more likely to say, nah, God, and they might have thrown it in the trash. Yes?
How do you quote that methodology compared to Eklund's
Oh,
study,
yes.
the scientists?
Yes.
She must have had the same kind of difficulties with a scientist.
She did. One difference there is she had the benefit of a research firm and email addresses, so she had good phone numbers and email addresses on the school websites of whatever school that the scientist was working at. And so they were able to call and email. I think their policy was 10 calls and 10 emails until they got through, unless they were told, absolutely no, stop contacting me.
So what percentage responded in her study?
Hers was 72 or 73,
Wow.
which even among like high-level academics
Sure.
was an incredible accomplishment.
Incredible.
And I still feel proud, even though I didn't really do anything about that. But yeah, did you have a question too?
You had a subset of questions about if they do believe in God's existence, what religious
Yeah,
tradition
we're
they follow.
going to look at that.
Yes, that's my next. I think that's my next slide. I have. Okay, no, not quite. First, in academia, Stuart talked about the difference of what he called of his definitions of spirituality and religion. In the social sciences, at least sociology, which I know best, religion is considered to be more the sense of organized religion, actual organizations that have spiritual matters as their main thing that they do. And spirituality is this new up-and-coming thing in the literature, this sense of a search for the sacred, like Ken Pargament has, something more individualized. And actually among the scientists that Elaine Ackland did, most of them didn't very much affiliate themselves with a religion, but they all considered themselves to be very spiritual, or a lot of them did. And so my population is the overall one there. The US population is on the very end. So the blue is what they would all call themselves spiritual. So a lot more, consistently, across the board, all of them, or more people will consider themselves to be spiritual than they will say, yes, I'm religious. They're a lot more comfortable with the term spiritual. And that's the US population as time has gone by. That seems to be just a trend of the way everybody's going.
And yet, this too, these are physicians all across there.
Mm-hmm. Yeah, all
Well,
four.
not U.S. population, right?
Right, but on this side.
Okay. But it's really interesting, upwards of 70% of active physicians in Houston would say they're spiritual.
That's right.
But even 55% would say they are religious.
Yeah, that's true.
That's high.
It is, which I would love, given another grant or something, I would love to really get to everybody and find out.
Okay.
Is this really? Right, and so I teased apart those two. The graph that you saw was the people who consider themselves to be very spiritual or moderately spiritual, and I combined them together. The jump between very spiritual and very religious and versus not at all, it's a lot more pronounced, that a lot fewer people will say that they are very religious. They're okay with the term moderately religious. And a lot more people, you'll see 20%, so twice as many people say, I'm not at all religious. But half of those people are okay saying that they're spiritual. So here's my lovely pie chart of everybody's denomination. The breakdown of that the biggest chunk is Protestant, which isn't too surprising, being that we're in America, and not even more than that, the South. The Catholics come in next at 19%, but closely followed by the group that says they have no religious affiliation, which is 17%. Mm-hmm. And so again, 11% Jewish, and the rest are filled out by the other category, which could be anything that they filled in, or the Muslim, Mormon, Orthodox, and Buddhist. So predominantly, you can see that these are the big things that we're dealing with. And again, because I had the different populations to compare them to, I made another bar graph. So the blue is our doctors here in Harris County. The red is the national study of physicians that Farr-Curlin did up in Chicago. The green then are the elite scientists that Elaine studied. And then the purple is the national public. So especially telling here is that we have fewer Protestants and Catholics than Farr-Curlin found for the nationwide sample of doctors. So that says something about Houston, in particular, having slightly fewer Catholics and slightly fewer Protestants than across the board. Also slightly less Jewish. But the most thing that surprised me here was our category of none was higher than both Curlin's study, the national physicians, and the US population. And we also, the other category is interesting to me because of our international kind of status in Houston. and the Texas Medical Center also, thinking that the other category of Buddhist, Muslim, and Hindu and things could be bolstered by the fact that we have more of an international population. Any questions about this? You had, John, you wanted to say something.
I was going to say about the last slide, and I forgot. So go ahead.
Oh. All right, I'll try to go through. Now, another measure of belief that social scientists have been using is to find out what people believe about religion itself. So you can see the people who say there's very little truth in any religion, there are basic truths in many, and there's the most truth in only one. Here again, we map more closely with the general population than Elaine's study of elite scientists, in the skeptics category at least. But the thing that surprised me here is our high population of people who said there is the most truth in only one religion. And this is the second part of information that I saw that made me think, again, to the responder bias. There's a way, and that's one of the future things too, if we can control for that, then we could be able to see if that goes away, or if there is something about us that's actually a significant thing. So. We also asked, in the last 6 months, have you engaged in any of these other practices? So like Stuart was talking about, these ways that you can express your spirituality apart from any commitments of affiliation with an organized religion. And so we have many people participating in prayer and things like reading the sacred text. Even yoga had a good strong representation. So these people are practicing things, even if their rates of religious attendance aren't as high.
And when you say people, you mean physicians?
Yes, these are all physicians.
Houston physicians.
These are all of our Houston physicians. So here's the other hallmark way to tell about how committed people are religiously, is how often they go to church. So we've asked, and again, I have our different populations to compare them to. So again, we would track really closely with the US population as a whole. But just so, as opposed to the elite the elite scientists. So speaking that the higher education doesn't necessarily determine how religious you are, that that would be just great to go further into research of find out more about why that connection is the way it is. So from this, we were able to see that the physicians' religious and spiritual views, when I use RNS, that's my abbreviation, they're very similar to those of the general public, more so than I was expecting. I was expecting somewhere in between the physicians for them to be between the public and scientists. They're also more likely to say spiritual than religious, and they're also more likely to say that there are some other religion or of no religion at all. The general population isn't as agnostic/atheist. That's medicine. Views on religion and spirituality and medicine. I found this terribly interesting. That was one of the questions, a standard question that Afar Kurlan asked on his national study of physicians, and we did as well, finding out how much of a calling they feel that their role in medicine is. That 92% of them said, yes, I feel a deep sense of responsibility for reducing pain and suffering in the world. And they asked this of the general population, and it was a much smaller percentage. So we're dealing with a very committed population of people who are dedicated their lives to reducing pain, and they see it that way. It's not just a job for them. So they also asked if the influence of religion and spirituality on health is generally positive, generally negative, is it equally, or does it have no benefit? And overwhelmingly, they say generally it has a very positive influence. The thing that was surprising to me, though, when we asked, do you think God or another supernatural being ever intervenes in patient health? More than half of them said yes. That somehow that wasn't my expectation. I was expecting more of the hard-line facts, like logic and reason is all there is. There's no room for fuzzy-wuzzies in the clinical surgery table and stuff like this. Or people, and surgeons, of hearing them having more like God complexes. Well, they got better because of science, and that's the end of the story. But more than half of them. Surprised me. The next stage was finding out how do they feel about dealing with religion when they're talking with patients. How do how do they make that balance? So we asked, how appropriate do you think it is to discuss these issues? On the left it says when a patient brings them up, and on the right is how appropriate it is for a physician to inquire about a patient's religion or spirituality. And so the top bar is when it's always appropriate or usually appropriate. The green is sometimes, and then the purple, the bottom, is always not appropriate. Yeah, the colors kind of blend together. So overwhelmingly, over 60%, 64% say yes, it is fine to discuss religion when a patient brings them up, but much fewer, more like 25%, will say that I'll actually ask about it. So they don't think it's appropriate for a doctor to bring it up and ask the patient about, but they're much more comfortable discussing it when the patient brings them up themselves. And here again, so we have, you're talking about this, the left is talking about your own religious beliefs and experiences with the patient versus praying with the patient. And the top one is the people who say never, in no situation is that okay. In the middle, the largest section on each of those is only when a patient asks. And at the bottom it says whenever the physician senses that it would be appropriate. And so again, we have some hardliners saying that's never okay, that's never a place for that in medicine. But a large part of people leave it up to the individual doctor, saying sometimes it's okay, you can bring it up whenever you think it's right. And a lot of people just take the stance, it's easier just whenever the patient brings it up. I'm not going to, but if the patient will, then that's fine with me. So we asked, what are some things that discourage you from talking about it with patients? And again, the concern about offending patients is the biggest thing on their minds. It's the top of their list when it comes to those things. So other things, the concern that colleagues will disapprove, I found that interesting because we asked that of the elite scientists, and there was much more pressure from the academic community that religious scientists felt rather than our physicians. That's not a really big deal for physicians. They don't really care about other doctors. It's all about the patient for them, which seems very appropriate and fitting, actually, for their stance of authority, their exposure and vulnerability to lawsuits and things like this. So some were generally uncomfortable discussing religious matters in general, but
it's kind of significant that 25% felt they had insufficient knowledge and training. Mm-hmm. And we're trying to identify places where a felt need is that we could actually offer that kind of training here.
That's right. That would fit in really well with the Institute's goals and mission. So this further is how much do they enjoy and how do they feel comfortable talking with patients about these sort of issues. It's about evenly split on do they enjoy talking about them and whether they ever inquire about them. But again, overwhelmingly, this would you feel comfortable discussing them if the patient brought them up? And overwhelmingly, they'll say yes. So that tells me even if they're not the same religion, or if they're one of our group of nuns, the 17% who don't have any religion, they'll still be all right with talking about it if they bring it up. So I think it's very respectful of them. We also threw in some questions on chaplaincy. So this was not something in either of the previous studies. This was something that we developed on our own. That was really John's idea and wanting it, and I sort of crafted it to make it legit. So this, I saw though there's a discrepancy or a parity here between 85% say yes, chaplains are an important part of the healthcare team. We also ask, how often do you actually refer patients, though? Because it's one thing to say, yes, they're wonderful people, but if they don't actually ever use them as a resource, that'd be telling to me. I mean, I imagine that would be telling as a chaplain, like, okay, you respect me, but you don't give me any work to do. So even going just for the people who never refer patients to chaplains, almost more than a fourth of them don't ever refer them.
Could a big part of that be that they just seem overwhelmed with work, that they're there for one task?
Repeat the question. We can't hear.
The question was, Who is it that's overwhelmed? The doctors.
Doctors.
The doctors feel too overwhelmed to refer them to.
Yeah,
to
and they're in
chaplains.
and out, pay for the golf cart, the bar, that sort of thing.
That's true. That could be. That would be interesting.
Ask me if I wanted to see a chaplain. I
Wow.
always said long chaplain, John.
Well, that would work well.
We
He said he
can't
always
do-
had his own chaplain. He's never had a doctor actually refer him to a chaplain. So that experience, I mean, apparently it's pretty rare anyway.
Right.
If the doctors themselves are saying, yeah, I heard they were doing.
Well, I wonder, the difference in specialties wouldn't make a difference in your numbers on
We
a
didn't
lot
check.
of those
True,
categories.
true. I took out, for this question of how often do you refer patients to chaplains, there was an option for none, I don't see patients. For some people didn't see patients in a hospital. So that took out a lot of people, and these are just the people who were left, the respondents who it applied to. But that's one of the future the areas for future research is to find out if some of these differences are based on how often they deal with patients, how often they deal with terminal patients, if they're a
They're
family
surgeons or if
practitioner.
they're-
Yeah, surgeon versus family practitioner versus oncologists.
Yeah.
That would be terribly fascinating. That's in the future. Oh, well, there we go. So that's the top one, I would say. The medical subfield, just like Pat said, could be very, very interesting of predicting whether or not physicians, or how comfortable they are talking about religious matters, or their personal beliefs on whether God actually does play a role in medicine. Also, whether current religion, if certain religious backgrounds are very consistently believing in God's intervention, or all the people, if all the Catholics always referred their patients to chaplains, then that would be very interesting, a telling note about the role that their specific Catholic faith plays in the way that they practice medicine. But that's a little more sophisticated than what I've been able to do so far. Further than that it would be great, some of these doctors in going through the surveys, I'd love to actually talk to them, sit down with them and probe, get it more in depth, which you can only do so much with a questionnaire of A, B, C, or D. Right. And then, of course, that would be nice to get the numbers up to really find out and make sure that our results weren't just because we happened to find all the religious doctors and they were the ones who responded. So that's some things like that. Implications that I see for ISH, at least immediately, understanding and pointing out areas that we can step in and fill a gap, a need of doctors saying, hey, I don't have enough information or training in this area. We can step up and do that. There is a lot of research showing from different hospitals that show that patients, whatever percentage of the time, but a majority of them would say that they would be open to and would actually appreciate a physician bringing up spiritual matters with them before a surgery or before something major. But the doctors aren't doing that so much. If they're all afraid about offending the patients, and the patients would love to talk about it but are intimidated, then we could just say, hey, you guys should talk because you both want to talk about this. Our physicians are very similar to the population, so we don't have to, with scientists, one of the main things that they have to do is realize, all right, all of you non-believing scientists, you need a way to talk to believing general public because your funding comes from the public, and you need to learn some language to build some common ground here. So we don't really have that problem. That's already made for us because they're very similar to the population anyway. We're all very diverse. And to follow up with what Stuart had gone over, that there are ways that we can encourage our doctors to encourage their patients in their spirituality without being specific, or then a physician of one religion could encourage a patient of an entirely different religion just by saying, all right, these practices are good. They're good in your religion, but also from a medical standpoint, they have merit. And so if I can encourage you to do those, let's work something out. Let's work out a contemplation regimen or meditation thing with it. And so that's the gist of all of our work. anything